We would like to take a minute to let you know what you can expect after your wisdom tooth procedure. The first thing you will want to do is to get something to eat and drink. We suggest something cold and soft, as your mouth will be numb. If the bottom wisdom teeth were extracted, it is a good idea to remain on a pudding texture, soft, non-chew diet for the next 72 hours to refrain from getting food particles in the extraction sites.
Viola Nash here. I'm going to give you a few helpful tips to get you through your wisdom tooth removal procedure. Some of the assistants are going to go over some post-operative procedures, and listen because this is going to be very helpful.
When can I eat and drink?
When you leave here, we're going to suggest that you have some cool, soft things because you're going to be numb, like pudding, ice cream, Jell-O, mashed potatoes. Stay away from pizza and tacos, y'all. That's not soft.
It is important to remember pain and swelling can be different for each individual. Pain and swelling will generally increase for the next 72 hours before it peaks out and slowly goes away. Staying consistent with the pain medicine the doctor has provided for you is important to maintain good pain management. Taking ibuprofen as an anti-inflammatory is also a way to keep the swelling at a minimum during the first 72 hours.
72 hours? Is that like 3 days of Netflix?
After surgery, it is common to have swelling in some areas of the face. Ice packs can be used to reduce the external swelling you might have. There will also be swelling within the mouth that can be alleviated by eating cold foods such as ice cream or frozen yogurt.
I had my wisdom teeth out yesterday and I'm like super swollen.
You just had your wisdom teeth out. You're going to be swollen. That's why it's important that the first 72 hours you rest. Eat your ice cream, your smoothie things.
Mom, I have soccer practice tomorrow. Can I go to practice?
We're super serious when we tell you to rest. No baseball, no tennis, no band practice, no kayaking, no lifting weights. Just relax. Let your body heal.
Gently rinsing with warm salt water a few times a day can help in accelerating healing time. Avoid mouth rinses with alcohol or bleaching agents. It is common to only have stitches in the lower extraction sites. These stitches often dissolve and can vary as to how long they last. As a general rule, we do not give out irrigation syringes. We have found that these can slow healing if not used correctly. In your take-home bag, we will be supplying you with gauze that you can use as needed for the post-operative bleeding. You can expect intermittent bleeding for the first few hours after surgery. This gauze will need to be exchanged periodically. It is very important that you bite down on the gauze to apply pressure to the wound. Patients often ask when they can stop using gauze. The answer to this is when the blood is more of a pink color instead of bright red. If for some reason you notice bright red blood returns, you can again use the gauze to apply pressure by biting on it directly over the extraction sites until the blood is light pink.
You are going to get a goodie bag full of gauze, a chin strap with ice packs to keep your cheeks cool. This is going to make you feel better.
How long do I keep the gauze in?
People, change out the gauze about every 30 minutes. If you're bleeding, you don't just set the gauze in there. You roll it up, put it in the bag, and bite some firm pressure. This is going to help stop the bleeding.
Was I supposed to go home with a little syringe thingy?
We don't give the irrigation syringe because it slows the healing if you flush that out too frequently. Our doctors are really good about putting stitches in each of the lower sites to help prevent food and debris getting in there. Hence the soft chew diet. Creamy things.
To end this video, I would like to remind you again that the next 72 hours can be critical to how fast you can recover after your procedure. Adequate rest, following diet instructions, and utilizing the medications that your nurse will go over with you during your recovery period is the key to having the best outcome post-operatively. We may not require you to come in for a follow-up appointment after your procedure. However, we should be your first call should you have any concerns or questions. We wish you a speedy recovery.
If you have a concern and you feel like we need to take a look, we're glad to do it. Give us a call, we'll get you in, and we're here to help you get through the procedure and have a great experience. Viola Nash, over and out.